Pacemakers have been around for a long time, and they're very reliable and good devices that have saved a lot of lives, but they're not perfect. In order to put a pacemaker in, usually it requires a surgical incision, usually right along the shoulder here. There's a vein underneath the skin that's typically pretty superficial, but once you're in the vein, we pass under X-ray one or two little wires, depending on the circumstance. But they go in the vein, and then under X-ray, they get deployed in the heart. 5 to 7 years down the road, when the battery is depleted, that device needs to be replaced. And that requires another operation, opening the pocket, taking that generator out and replacing it with a new one. Every time you do that, when you open the pocket, again, you risk introducing infection into the pocket. So those are some of the issues with a standard pacemaker, and that's why there's been a push to develop pacemakers that don't require leads or wires in the heart. And that's exactly what the Micra is. And so here's an example of the Micra. You can see it's like a little capsule that has little barbs on the end. And this is the combination of the pulse generator, the battery of a regular pacemaker, and the wires all contained in this little pill-like structure. Well, typically we go through the vein in the right leg, it's called the femoral vein, and then we put an introducing tube, or sheath, if you will, which is the size of a very fat drinking straw. That goes up into the right atrium, and there's a way to make that curve across the valve so that you can advance it into the right ventricle. And then we turn the catheter so it's pressed against the wall that separates the right ventricle from the left ventricle. And we actually push this out of the tube into the myocardium, into the muscle. And the nice thing about this little device is, if it's in a good position, it can last up to 12 years. And then if someone is at the point where they need another pacemaker, you can simply put another one alongside this one and give them another 12 years. Probably by that time, the devices will last longer than 12 years. But it's a really big step forward, I think, for lots of patients.